I tell my patients that early detection equals cure.
Dental practitioners, they are the experts in the oral cavity. They're the ones who are going to most likely be able to identify abnormal changes early on.
The dental community really has and holds an expert status in the detection of these oral lesions. They work in the head and neck region and the oral cavity region every day, and therefore they pick up those lesions pretty early. Much earlier phase than would be picked up otherwise if you waited till the patient is symptomatic.
Anyone can identify a large lesion, large exophytic cancer, tongue cancer in the mandible. It's the subtle signs and level of awareness that the dental profession has to have to try to save these people's lives.
So we expect that there'll be about 54,000 new cases of head and neck cancer in the United States this year, about 2,100 new cases in Illinois, and of those 2,100 new cases, there'll be about 440 deaths. A dentist is going to find a number of those cancers, and you can expect to find about a cancer every 10 to 12 years in your practice.
Oral screening exam really is just a thorough exam of all the mucosal surfaces within the oral cavity, focusing primarily on the lateral surface of the tongue and the ventral surface of the tongue, but really looking at the buccal mucosa, the palate, the alveolar mucosa. Really only takes about a minute.
We're really looking for anything that's abnormal. So any lumps or bumps or anything that's just not right. Any white patches, so white patches hold about a 6% risk of transforming to cancers. Red white patches have an even higher risk, and then red patches have the highest risk. So anything that's sort of friable or bleeding, any ulcers, especially ulcers with rolled borders, and certainly anything that's not healing in about 2 weeks is something that definitely needs evaluation. Some mucosal masses on the palates or the cheeks definitely also need evaluation. New paresthesia of the lips and chins. Any loose teeth that's really out of proportion with the rest of the exam. Particularly interested in high-risk subsites, so that's floor of mouth, retromolar trigon, and lateral border of the tongue.
If you see a patient and you pick up a cancer as a small lesion, as a T1 cancer, they're much likely to have a better survival rate, so roughly about 90% plus in terms of 5-year survival compared to somebody with a stage 4, depending on what type of stage 4.
Early diagnosis of oral cancer is paramount to outcome. Early stage cancers, stage 1 and 2 cancers, are treated much more effectively, have a much higher 5-year survival rate. So early detection goes a long way to not only saving lives, but also improving quality of life.
If you look at the survival rates for oral cancer over the last 4 to 5 decades, we've really made no headways in terms of improvement in the survival rates. The single most important prognostic factor was, and still remains, early detection. And that's where really the dental community comes in.
So there are some well-reported risk factors that I think everyone's aware of, smoking, drinking, and they really have a synergistic effect too. So alcohol plus tobacco has a really high incidence of cancer, but we're actually seeing a new subset of oral cancer patients. That's mostly younger female patients with no risk factors. Some of that is driven by HPV and more in the oral pharynx than the oral cavity.
Usually we would encourage the dental community to, if they see something that's abnormal, to go ahead and refer to an oral and maxillofacial surgeon, and if a patient does have cancer, to locate a provider, usually at an academic center that is head and neck trained in the field of head and neck surgery with an oral maxillofacial surgery background. There is still some work to be done on behalf of the dental profession in raising public awareness and to really use that expert status to really educate the patients and the public about oral cancers.
Dentists save lives, and they really do.